So today we're going to continue our discussion about the condition that we started talking on my last video, and this is what we call axillary web syndrome, otherwise known as cording. So before we continue, let me just review what I just said on my other video, that this patient usually come to you with their arm in a protracted position, shoulder is internally rotated, the elbow is usually flexed, and also the wrist is usually flexed as well. And take note that it's very painful for them to rest the arm on the side. That is the reason why they usually come to your clinic in this protracted, elbow flexed, wrist flexed, and internally rotated shoulder position. However, let me emphasize that the most commonly limited movement in the shoulder that you see in patients with cording is the shoulder abduction. Okay? Now, also remember that the cord is taut and very painful with palpation in some cases. But I've seen cording in the past that it's not actually painful, so it didn't really bother the patient. Now, today, the focus of our discussion is why do we treat this condition? Okay, so always remember that this will result to prolonged shoulder immobility. And when the shoulder is immobile for a long period of time because of the limitation in the movement, because of pain, tightness, and whatnot, it could alter the movement pattern of the shoulder. It will result to poor posture, malalignment, muscle imbalance, impingement, frozen shoulders, soft tissue tightness, and chronic pain. So those are the reasons why we need to treat and help this patient with cording, or what we call the axillary web syndrome. So how do we treat cording or axillary web syndrome? We can do elective manual therapy, wherein we can do skin traction starting at the most distal portion of the cord working proximally. We can also do a gentle stretching of the superficial tissue over the cord. Other technique that we can do is we call it cord bending. So while the cord is tensed, when a patient is positioned and stretched, you're gonna apply a perpendicular pressure on the cord with your thumb while bending the tissue in the opposite directions with the other fingers. We can also do a gradient compression bandaging, and this is just usually done if the cord extends into the arm. So we can teach them home exercises, postural education, myofascial release, scar mobilization, nerve glides. Okay, I don't know if you heard about nerve glides before. We can also teach them a strengthening program of the weakened muscles. So, if you are interested in learning the details of the above techniques so you can apply them to your patient, please consult a certified lymphedema therapy specialist. And if you are a patient suffering from this disabling condition, okay, get a referral to see a lymphedema specialist so you can be treated as soon as possible. That's all, and please wait for my next video.